First, I want to start by asking how many of you are here for the first time for one of our meetings? Cool. Wow, welcome. Thank you so much for joining us. I really appreciate having all of you here. Psychedelic-STL exists basically to support dialogue, education, and integration around psychedelic experience and non-ordinary states of consciousness. And I want to thank all of you for helping to create a supportive space of curiosity and respect. Today we're fortunate to have Kate Schroeder speaking with us. She spoke at WashU last week at the Welcome Home Forum to about 140 people. So we're really fortunate to have her. And with that, I will turn it over to you, Kate. Thank you.
Okay, thank you. Thank you, Mike, and thank you to the Society for having me here tonight. I'm really glad to be here, and I'm glad to see everybody, and welcome to the new people as well. That's wonderful stuff. You know, when Mike asked me if I'd be open to speaking, I got super excited because one of my passions is educating and education. So that's really what tonight's going to be about. It's going to be about a conversation about psychedelic-assisted therapy through a trauma lens. And the goal this evening is to offer something that is grounded and it's thoughtful and it's practical. You know, something that helps cut through hype and fear that often surrounds this topic. You know, we hear a lot about it in the news, social media, and all that good stuff. And, you know, sometimes it's accurate, sometimes it can be built on. And so that's really what tonight is about, is being an educational space. It's not therapy. It's not going to be about medical advice. It's not about a sales pitch or anything like that. It's just simply an opportunity to slow down, to think carefully about a topic that is getting a lot of attention right now, and for good reasons. And so my hope is that by the end of tonight, you're going to have a clearer sense of what the work actually is and what it's not, and what really matters when somebody's considering this path of healing. So if there's one frame that I really want to make sure that we hold tonight, it's this, that powerful tools require very mature containers, okay? Psychedelic work can be really meaningful, and it often is for people, even life-changing for lots of people. But it's not casual work. So it's not just about a medicine or the medicine. And it's not just about having an experience or something big happening. It's actually about the context that the work happens in. So that includes things like preparation, pacing, and support, and about what happens afterwards. Because the medicine opens things up, but what you do with it afterwards is really where it becomes therapeutic. And so, you know, just like in other areas of medicine and mental health, we already kind of understand that principle. And so in psychedelic work too, especially an intervention that's as powerful as this, it really does require a thoughtful structure around it. So it's a very applicable kind of principle to the medical stuff too. Because when experiences, and psychedelics do this for many people, when they open something very meaningful, something emotional, something psychological, people absolutely need to have a container that they can actually work in and hold that process safely. So tonight I want to talk about this work with discernment rather than hype. And because careful, remember this, careful isn't necessarily the enemy of powerful. Careful is what makes power stable and safe. And so that's what we're going to really spend a lot of time on tonight, looking at and exploring. And so I'll tell you a little bit about who I am. So my name is Kate Schroeder. I'm a trauma therapist by training. My clinical work has long centered around nervous systems, attachment wounds, the places where insight alone often doesn't reach. I'm also a certified psychedelic-assisted therapy and a licensed psilocybin facilitator in Oregon and in Colorado. And my path into the psychedelic-assisted therapy, it didn't necessarily begin with a lot of excitement or kind of trend. It actually began with a lot of skepticism. And what happened was probably 5 or 6 years ago now, I had a client come in and, you know, plop down on the couch and they go, "Hey, Kate, what do you think about psychedelics?" And I was like, "What?" Like, you know, I grew up in the 80s, Nancy Reagan, don't do drugs, all that good stuff. So my immediate response was, don't do drugs. Like, it's very simple. But like often when I have these big reactions, I got very curious and I started exploring. And what I realized was that, you know, psychedelics allow us to reach deeper levels than insights alone. And what a powerful possibility this could be for working with trauma at an even deeper level. And so like many clinicians, I had questions about whether it could actually be helpful. Was it trendy? What was this all about? or whether it might sometimes be misunderstood or misused. And so this kind of provoked my journey into becoming licensed, becoming certified, and all of that. And one of the big primary reasons that I chose to do that was because it felt really important to me to also bring that back to our community here in St. Louis, Missouri. You know, as the Midwest, we often lag behind the coast on things, but you know, it's important that we have access to this too, or at least access to it in a safe and stable kind of way. And so if we think about healing and we think about things like trauma, you know, and remember, trauma doesn't have to be these big, gigantic experiences. Sometimes trauma is more what they call the little t trauma kinds of things, but it lives in our bodies beneath cognition. It's a survival response. You know, it lives in patterns that don't necessarily shift simply because we understand them intellectually or cognitively. If that was the case, we wouldn't be here probably. So there, you know, there's this gap between knowing and a nervous system that's still reacting. And that's where I really started to see lots and lots of potential for this to be a very powerful modality to learn about. And throughout my journey, what's made me careful about psychedelic-assisted therapy is not only seeing what's possible when it's done responsibly, but probably almost more importantly for me, it's about seeing what can happen when people move too fast, they skip the screening, they don't have the support around them, they enter powerful experiences without enough preparation or integration. So I'm not evangelical about this work. I believe in it, and I believe that it can help a lot of people. And I respect it enough, though, to be very, very cautious. And so that's what tonight is about, is really exploring what this looks like, what the path is, and where we go from here. So this is just a little bit of an overview about where we're going to head tonight. First, we'll talk about, you know, what is psychedelic-assisted therapy actually, because this phrase gets used in a lot of different ways and a lot of different kinds of capacities. And then we'll talk a little bit about some of the different pathways that people hear about, and also how to look for and think about readiness for this kind of work, okay? And from there, we're going to spend a little bit of time on safety and what safety means, because it's not just about avoiding a bad trip or something like that. There's a lot more that goes into it. And then spend a little bit of time talking about some legal and ethical basis, because those questions often come up often when people are exploring this topic. And from there, we'll talk a little bit about the differences between microdosing and macrodosing. They're both powerful in their own unique ways. And after that, we'll come to what I actually believe is the heart of the work, the screening, the preparation, and the integration. And then at the end, we'll have some times for questions and discussions. And so, you know, as questions come up, you know, jot them down, hold on to them, because we'll spend as much time as we need to at the end, at least up until 8 o'clock. I think that's when Mike said we have to be out, but we can talk out there too. But we'll definitely have time to explore that stuff together, okay? So my goal tonight is not to convince anybody to pursue this work, but to help you understand it well enough to think about it carefully and responsibly. So I thought we might take a minute to just kind of settle and slow. You know, I don't know about you, but it's Thursday and I'm kind of tired. It's been a long week rushing out here after traffic and all that good stuff. So I just thought we'd take a little bit, a few minutes just to kind of settle in and arrive. So you're welcome to join in this. You're welcome to not. It's really up to you. But this is about kind of centering and grounding and getting here. And so if you'd like, you know, you can do this with your eyes open. You can do it with your eyes closed. It's as you wish. But as you settle in, you might just kind of begin to take your attention inward a little bit, noticing your feet on the floor right now. You know, if it feels right for you, you can gently wiggle your toes or move your feet a little bit just to remind you that those are your feet. They carry us around all day long. You notice the chair that's supporting you, so against your back and holding you upright. You can take a nice, slow breath, you know, and really give yourself permission to take that breath in whatever way that it's happening. That's the most important thing. Without trying to change anything, you might just simply notice a few sensations in your body. So whatever it is that you notice, it could be maybe some pressure, or maybe it's warmth, maybe it's some tension. Maybe you feel a little bit of heaviness somewhere in your body or some lightness. Now just take a moment to connect in for a moment. And as you're doing that, you might spend a minute or two just kind of thinking about what brought you here tonight. You know, what is it about this topic that you're interested in or that you're curious about? And what is it that you might like to know or know more about before you go home? But just take a little time, whatever feels right for you. And when you feel finished with that, just gently let yourself orient back to the room around you, back to the outside world, taking your time. Opening your eyes if your eyes are closed, exhaling maybe. You know, you're here tonight, and that's wonderful, and that's enough. Okay, let's talk about what is psychedelic-assisted therapy. You know, a lot of times when people hear the phrase psychedelic-assisted therapy, it means a lot of different kinds of things. It's a lot of different contexts that it's used. Some people might think about microdosing. I think a lot of people often think about the larger guided journeys. Some people think about ketamine clinics, or maybe retreats or ceremonial spaces where the medicine's used. Even sometimes people think about the underground spaces where this stuff is used as well. So I want to start by simplifying something off the bat here. Psychedelic-assisted therapy is not just about taking a substance. It's actually a structured therapeutic process. And it's one of the important distinctions that we make about this between recreational use and therapeutic use is that it has this structure and it has this container. You know, if we think about psychedelics in the context of therapeutic use, psychedelics for therapeutic use are used to connect more deeply, whereas psychedelics, often for recreational use, can sometimes be used to check out, you know, forget what's going on in life, be distracted, you know, all those kinds of things. So it's a very different energy that's there. And as most of you know, people have used psychedelic substance both recreationally or in ceremonial contexts for a very, very long time. So they're not new. You know, they're new to our hemisphere and our use in this kind of way in the dialogue. But even that, you know, there was the psychedelic revolution and all that. So they're not new. They've been around a long time. But psychedelic-assisted therapy is not simply about having an interesting or powerful experience. It's about what happens around that experience. So the screening, the preparation, the therapeutic container, the support during the process, and the integration afterwards. So in other words, the medicine may open the door, and it often can and does for people, but the therapeutic piece comes through the whole arc of that. All right. I'll give you an example about this without identifying anything, but a client once told me, and this is a really great kind of concept to hold, and it's something I hear a lot in trauma work. They said, you know, I understand my trauma work. I've talked about it for years. I've connected the dots, but my body still reacts like it's happening now. You know, I'm sure we've all had similar experiences of that on various different scales, right? And so that gap between intellectual understanding and nervous system response is where many people begin to feel curious about, you know, what is psychedelic-assisted therapy and can it help me? And so when I like to talk about this, one of the big things I emphasize is that it doesn't replace therapy. It's an actual supplement to your therapeutic work, okay? But because it sometimes opens access to layers of experience that the thinking mind can't always reach, we have to be really careful about how we use that. And in trauma work, we often say that the body keeps the score of experiences long after the mind has made sense of them. And it's very, very true. And so sometimes healing involves working with those deeper nervous system responses and patterns than just the insight alone. And this is where psychedelic work becomes really relevant. And so at its best, psychedelic-assisted therapy, it's a structured process that includes specific phases. So screening, preparation, support during the experience, and then integration afterwards. And this distinction matters because one of the biggest misconceptions in this field is that the substance itself is the treatment. I mean, most people, when they think about psychedelic-assisted therapy, a lot of people think about, oh yeah, it's the medicine, it's the psilocybin or the ketamine or MDMA or all that stuff. That's actually a tiny piece of the equation. The container matters just as much as the compound that you're using. And the quality of the therapeutic relationship matters even more. So, it happens in lots of ways too. Sometimes people imagine psychedelic work as insights that just boom, just kind of happen. But what often happens more commonly is that unfinished emotional material actually becomes more accessible. So that could be things like grief that hasn't been touched in years, or fear that suddenly has a language, that kind of low hum that's been in our bodies for a long time. Relief, a lot of people experience things like relief alongside vulnerability. And sometimes memories, emotions, relational patterns that have been held really tightly in our bodies or in the nervous system, they begin to loosen. And so that's wonderful. And it's also why having this container around it is so important. The preparation, the integration, because when meaningful material emerges, people need support to be able to process it and integrate it safely. So out of curiosity, how many of you all here tonight have mostly heard about psychedelic therapy through like podcasts, documentaries, social media, news, that kind of thing? Yeah. What other places have people heard about it from?
Science conferences.
Cool. Yeah, great. Anybody else?
Book.
Wonderful. Michael Pollan's book and others? Yeah, for sure. Yeah.
Instagram.
Instagram. Of course, Instagram. Yes. And it's great because the conversations are happening and we're seeing a huge increase in curiosity about psychedelics right now. What also I think is happening is that we're seeing, as the conversations are growing, I feel like it's important that we also have growing conversations about clarity, about what it actually looks like and what it actually entails. And that's part of why education around it is so important, because powerful tools tend to move faster through culture than the understanding of how to use them responsibly. That always tends to come a little later, right? And so we need to start having these conversations. And without good information, people sometimes end up relying on hype, social media stories, even incomplete narratives. No psychedelic experience is the same. So, we can talk about arcs and phases and, with different medicines, kind of more or less what everybody's going to experience. But no psychedelic journey is the same between person to person, and even in your own journey as you're working. So education helps. It helps slow people down. It helps us ask better questions. And it helps make decisions about this powerful modality and even the mental health from a place of understanding rather than urgency or curiosity. And that's important. That kind of discernment is one of the things that helps keep the work safe and helps keep it meaningful. So before we go too much further, I do want to name something interesting about what I've noticed around how people approach this topic often. And I hear this a lot in consults and things that I do in my practice. Often one of the first questions that people ask is, does it work? Right? Well, that's a pretty decent question. But I think what is probably a quieter and often more important question is the time right for me? Sometimes people ask that very question because they're in such a place, they want change, they need help, they're looking for something. But readiness is as important as does it work, okay? And does it work is pretty relative. It depends on what you mean. It depends on what kind of change you're looking for, it depends on the medicines and all of that, which we'll talk about here in a little bit. Because transformation, when we think about this, what I often like to respond back or explore with people when they're asking about, does this work? And I'm asking, are you ready? And we're looking through all that. And I think a really important question is to think about, if something really meaningful happened in my life, do I have the support to live with that change? Because that's a really important question. Very, very important question, because transformation isn't about just the moment of insight. It's about what happens afterwards. And sometimes I think people imagine that healing is simply about discovering something new, seeing something clearly, experiencing relief that they haven't had in a long time. But often, meaningful change often requires shifts in their relationships. It plays out in things like habits, boundaries, ways of relating to themselves and others. So those changes can take time to stabilize. And I don't think that's something that often we think about in the beginning. We just think about, man, I'm really hurting and I need some help. Will this help me? And so it's important to consider these things because readiness is not just about curiosity or how much we're struggling. It's also about capacity. That's a big piece here. Capacity in your nervous system, right? Capacity in somebody's life, capacity in your support systems, capacity in the relationships around them that are going to support whatever emerges. And so another big misconception that feels important, kind of touched on it a minute ago, is that often people think they're choosing a substance, right? They call up and they're like, hey, I'd like to work with psilocybin, et cetera, et cetera. But what people don't always understand is they're not choosing a substance. What they're choosing is a relationship to change. So how quickly things will move, how much support they have, how much uncertainty they can tolerate, because often what can happen in a psychedelic work is that it stirs the dust. So all these things that you've been holding against and your nervous system's been protecting you from feeling, psychedelics help us access that. So how much uncertainty can they tolerate as these things are coming up and they're working through them? How much they'll be carrying alone versus with guidance. So these are really important questions that need to be covered before someone even considers, which medicine they want to work with. The screening piece is really important, and we'll talk more specifically about that in a minute. Some of the different pathways that we often hear about are things like microdosing, macrodosing. Okay, those are two very different tools. And a question I often hear is, macrodosing, which is the big journey work, that must be better, right? Not necessarily. Okay, again, we think about capacity. We think about a person's nervous system. We think about the support they have in their life. And in psychedelics, in all mental and emotional health kind of work, but in psychedelics especially, support systems are really key. In fact, a lot of times, if someone's support system isn't robust enough, that's a big piece that we work on in preparation and in screening, because it really matters. Like, what do you do when all these things that you've been kind of holding against, all of a sudden they're here? So, macrodosing is a tool, microdosing is a tool. We hear a lot about clinical or therapeutic models. Research, right? There's a lot of number of institutions and states that have at least legalized psilocybin, not a lot, but a few that have legalized psilocybin enough for research purposes. Clinical, therapeutic models. We hear about retreat, ceremonial models, underground spaces. And these pathways are not interchangeable, okay? They're not necessarily better or worse, but they're not interchangeable. They all do very, very different kinds of things. They place different demands on the nervous system. So that's something to really think about too. They require different levels of support. For some people, a gradual and more supportive, slower approach may be the most stabilizing way to begin. And I've had that happen too, where people come and they say, I'm ready, let's do this. And what we've realized is because of nervous system capacity and all these other things, that they actually need to slow it down a little bit and prepare a little more deeply for that. And that's actually a very, very wonderful way to move forward. For others, maybe it's the deeper immersive experience, and that might be appropriate within the right therapeutic container. But the most important, I think, question, the key question really isn't about the medicine itself. It's about whether the conditions around the experience for that particular person are supportive enough for whatever might unfold. So, a big thing that I think we can't emphasize enough is that curiosity does not automatically equal readiness. And not being quite ready doesn't mean not ever. It just means with the supportive therapeutic container, that's part of the arc before, is let's get you to a place where you can actually drop into and really experience this work in a therapeutic kind of way. And sometimes the most mature answer is not yet, or not this way. And the beautiful thing about psychedelics is that, all the different medicines have, I call them kind of their own unique personalities. So, just because psilocybin might not work for you doesn't mean that there isn't another medicine or another pathway that might not be appropriate. So, having that knowledge and being able to work with trained kind of people who understand those things are really, really important, because sometimes the not yet just simply means not this one or not quite this way. And so there's ways to work with all of that, which is really pretty exciting if you think about that. So one of the big pieces that I think gets a lot of, isn't talked about enough, let me say it that way, is this idea around safety. Safety, when we think about psychedelic work, it is far more than just not having a bad trip. It's much broader than that, okay? People often think about safety in terms of things like really extreme situations, bad trips, panic attacks, medical emergencies, things like that. But safety is much, much broader than that. It exists on several different levels, okay? First, there's the nervous system level. So that's the nervous system safety. And it's about whether somebody's nervous system can actually stay within a workable range of activation while difficult or emotional material is emerging. So that's really important because psychedelics work. I mean, we'll just say that, they work. And so if the nervous system capacity isn't there, then that becomes a very important part of the preparation process to help someone build the internal resources and sometimes external resources around them too, to be able to handle what it is that comes up. You know, trauma work teaches us that when the nervous system becomes too overwhelmed, what does it do? It shuts down. It moves into survival responses, whether it's the fight, flight, shutdown, disassociation, whatever. And so when that happens, the brain is no longer able to process that experience in an integrated way. And that's where the flooding happens. You know, and that's often where people become destabilized. And so the material that's happening, you know, it's not workable material, or it can even sometimes re-traumatize. So nervous system safety isn't about just avoiding emotion or avoiding hard feelings. It's about having enough internal and external support that you can stay present with what it is that's coming up rather than being flooded by it, okay? Safety also includes psychological safety. So this means things like consent, agency, choice, a sense that the person inside the experience is still the one directing their own process. You know, that's a very big point I want to really emphasize here, is that a trained facilitator's job is not to direct the experience. It's not to help make your experience bigger. It's to be there with you as the medicine takes you where you need to go. And if you've prepared adequately, that's going to raise the chances that this becomes a very therapeutic experience. And therapeutic doesn't always mean rainbows and unicorns. Therapeutic might mean, wow, okay, I finally got to my layer of grief that I've been lugging around for 47 years. Now what do I do with that? Okay. So it means, you know, psychological safety also means having enough internal coherence to make sense of what's happening rather than getting lost inside of it. You know, and that's where that flooding can happen too. So pacing is important. You know, that agency is so critical. Safety also includes relational safety. So relational safety in terms of the client and a facilitator, and then broader as well. It involves things like trust, ethical boundaries, the capacity of the person holding the space to be able to respond skillfully if something arises. You know, their capacity to stay with their own discomfort, that can happen sometimes when you're watching someone else in a very intense experience. Because psychedelic experiences can and do sometimes open very, very vulnerable layers of your psyche. You know, grief, trauma memories, attachment wounds, and the relational field around that becomes incredibly important. You know, there's things like contextual safety, very, very important. So, like this setting, you know, the legality of the environment, that's very important too. The continuity of care. You know, what happens after the experience ends? You know, is there integration? Is there aftercare? What does that look like? Because even though the medicine session itself lasts a number of hours, the psychological material it can open continues long afterwards. And so it's very, very important that we think about that contextually and have those support systems in place. You know, that support system can look like things like your own therapist, because again, this isn't replacement for therapy. This is being able to have a place where you can go and process the trauma and the things you've been able to tap into. Support systems can look like trusted relationships, community supports, even other stabilizing things in someone's life. You know, when psychedelic experiences bring meaningful insights or emotional material to the surface, people often need time. They need a lot of relational support to process what's emerged. And relational support doesn't always mean somewhere to go and talk. For some people, that is. But even be able to go somewhere where people understand, like, you just had something huge happen. So I'm not going to pepper you with questions. I'm not going to ask, you know, what happened. I'll wait for you if and when you feel ready to share. And that's a very big piece of relational support too. Because without that, powerful experiences can really, truly leave some people feeling very, very disoriented and very, very alone with material that can sometimes feel bigger than they expected. You know, a big thing that we work on in prep work is intentions. Like, why are we here? You know, intentions are like maps, okay? They're not expectations or demands. Medicine doesn't do it anyway, doesn't respond like that anyway. But they're guides. They give us a sense of the container. What is it that we want to know more about, or you know, what do you want to explore? Or what is it that you're curious about? And so, if we don't have those spaces to be able to process that, we don't have the places to be able to prepare and to be able to manage things like expectations, because we all have them going into psychedelic work. No matter how much you explore them consciously, there's always a layer underneath that. People can feel really flooded or even destabilized with that. But with support, you know, these different sorts of experiences, different capacities, those same experiences can become very, very meaningful and stabilizing, and more often than not take time. You know, one thing I see happen often is that some people have very, very somatic experiences. And what that basically means is there's not a lot of external conversations or emoting or even emotional expression, but there are things happening in the body and happening energetically. And often you hear, you know, a clue that you kind of know things like that have happened is they go, wow, I didn't really say very much, did I? And it's like, no, but hold on, because that's, you know, it's like your nervous system is integrating this work in a very deep and very profound way. And, you know, the thing about psychedelics is that they're non-specific amplifiers. And so basically what that means is whatever's in there, they're going to amplify it. And that's why they're so powerful. So having that container is very, very important. You know, amplification itself isn't bad, right? We often think about that like, wow, that's going to be a lot. I mean, it's kind of why we're doing the psychedelic work in the first place. I can't get to this and I need some help. But it does mean, because they are non-specific amplifiers, that the screening, the pacing, and the support matter enormously. You know, wanting healing is not the same thing as being ready for acceleration. And that's a big thing that I think needs to be talked about in both screening and preparation. And recognizing that difference is a part of what makes this work responsible rather than reckless. And the thing about safety is that it's different for different people, right? So what might feel relationally safe to me may not for another person. And so being able to explore what does that mean for you is so critical, and helping build those unique, specific environments is really important as well. Which brings to another really important part of the conversation, which is, you know, how do people decide when to move forward, and when it might be most ethically, you know, the most ethical thing to slow down. And so let's talk about that for a little bit. I think probably one of the most underrated skills, or overlooked skills, maybe we can say it that way, in this work is knowing when not to proceed. Okay, most people have no problem coming. You know, people call and they want to do the work. They're like, they're ready. Let's do this. Okay, and I think that it's really important that as facilitators and clinicians, we also develop this other side of that equation, which is knowing when not to proceed, or knowing when not to proceed that way. And sometimes that is the most ethical decision, is to slow things down and to really build a broader stabilization before moving forward. And that's true actually not just in psychedelic work, but trauma therapy more broadly too. So, you know, having that ability to go in from as stable of a place as we can is often the key piece between an experience being very therapeutic or an experience being very destabilizing. You know, trauma work teaches us that moving too quickly can actually overwhelm our system, shut everything down, than actually help it. So pacing becomes a very important form of health care, of care in this process. And it's one thing that I work really hard with the folks that I work with, is learning that about them. What feels right to you? What kind of pacing feels right? And it's also, that includes things like dosages, certain medication, which ones we're going to use. And sometimes the most responsible thing is to pause, to slow it down, to shift to a different medicine, maybe redirect. You know, I've had folks who've come in and life happens as it happens, and there's a lot going on externally in their life. And it's just, they're not ready. They're not really ready for a big psychedelic psilocybin kind of journey experience. So we slow it down. You know, again, not now doesn't mean not ever. it means let's pump the brakes for a minute. Let's look at this big picture. Let's figure out how to get you stabilized. Sometimes that might mean shifting to working with a different medicine, or maybe doing a little bit of microdosing before we move forward in the bigger journey. If somebody's in the middle of major transitions, major loss, crisis, sometimes maybe it's a support system around them that's too thin. Maybe it's just simply the nervous system isn't ready or they're scared. All of these things matter, and sometimes in those moments, not now or not this way is actually a very deeply protective and ethical answer, and actually creates more safety so that when it's time to actually move forward and do the work, they feel a real sense of stability and agency and pacing of their own. Because the goal is not to push somebody towards the experience. It's not going to work anyway. It's to support their healing in a way that they can actually integrate. And so I want to talk just briefly on legality. I mean, I'm probably not going to tell you a whole lot of things that you don't already know. It's not legal here, okay? Psychedelics law, they vary widely depending on the medicine and on the state. Oregon and Colorado right now currently are the only two states where psilocybin is legal to use in a therapeutic manner, in a service center, state-regulated kinds of programs, okay? Interestingly and excitingly, there's a lot of enthusiasm here in Missouri. There's bills being pushed in legislation and things like that, which is really wonderful. So vote, talk to people, let's do that stuff. But right now, only Oregon and Colorado are the places where it is legal to use psilocybin in a therapeutic way. Ketamine is legally prescribable nationwide through licensed medical providers. It was originally an anesthetic that has been started to use in mental health treatment, and it is actually a very powerful medicine too. Sometimes when I get folks that come and they want to do big work with psilocybin, they're not quite fully ready. Sometimes we do a little ketamine work first, and that helps them get a sense of like, what is an altered state of consciousness like? It helps, we talk about these things in the prep sessions, like uncertainty and what do we do when painful or hard material comes up? Ketamine is a beautiful way for some people to explore that. And so it's really wonderful to have different medicines to work with, because often not now doesn't mean nothing. It just might mean not this way or not in this capacity. But something that's really important to mention is that legality and safety are not the same thing, okay? Just because something's legal doesn't mean that it's safe. A legal container can still be poor care. And I've seen some of that in Oregon and Colorado. I've seen that happen. And sometimes, illegal context does not automatically become unsafe simply because somebody means well, right? So when we're thinking about options, we're thinking about the medicine, I think the more useful questions often aren't just about legality. It's more about things like, who is accountable? How's the work being held? What training or supervision does the provider have? That matters. It's not the same as therapy. It's not at all. As a therapist who's gone through psychedelic certified training, there's a lot of differences. It's very non-directive. It's not about getting in there and making anything happen. It's about holding space. It's asking questions. When we think about safety and legality, it's asking questions like, what kind of support exists before and after the experience? What does that look like? The medicine is only one piece. And it's actually, in the arc of psychedelic-assisted therapy, the medicine is a very small piece. It's everything around it. It's what surrounds that moment. And that's often what determines whether the work is stabilizing and healing or confusing and overwhelming. So, we have to think about it in terms of safety, readiness, and things like that. So let's talk a little bit about some of the, kind of common pathways I think we hear a lot about certainly in terms of psilocybin. There's a lot of different psychedelics that can be microdosed, but psilocybin is kind of the big one that we talk a lot about. And I mentioned this a little bit earlier, but a common question that I often hear people ask is, what's better? Which one's better? And neither one is better. They're not, simply two sizes of the same thing. They're actually two very, very different tools. And, we think about microdosing. It's very small sub-perceptual doses taken over time. And the intention of this pathway, the intention of this tool is more of a subtle shift, more of a subtle change. So it might be a subtle shift in things like mood support, increasing some awareness, It can work for things like creativity and gentle shifts in patterns or habits. And from a nervous system perspective, if you think about this, think about microdosing in the framework of stabilization and regulation, okay? The goal isn't usually a big dramatic experience, and so that is often something that is important to talk with folks about is, microdosing is very different from macrodosing. It has a huge place in life, I believe, but it's very different, and the process is different and how it works is different. And so it's really more about supporting your system and becoming a little more flexible, a little more resourced, a little more able to notice patterns that previously felt automatic. And for some people, that's enough. That's what they need. For some people, this is a tool maybe that gets used before a bigger journey. I often have clients after a big journey, they move into doing some microdosing as just an ongoing support for their nervous systems. People often describe it as creating just enough space in their systems to respond a little differently to familiar kinds of situations. All right. And then on the other hand, you have the macrodosing, or what we all think of when we think of a big journey, okay? And that is a larger immersive kind of experience that can significantly alter perception, can alter emotion, it can alter your sense of self. And if you think about it on a nervous system level, it's a very, very different process, okay? Macrodosing isn't subtle. It's a big deal, and it can loosen that usual organizing structure of your mind and the nervous system. It works in that default mode network place. And sometimes people will describe this as opening things up, all right? Or therapy, 10 years of therapy in an afternoon kinds of things. But it really works to allow material that's been held tightly in your system to surface more fully. And so because they're non-specific amplifiers, that means everything, right? So that's where that container becomes really important. And it can stir up meaningful insights about things that, when we're in ordinary consciousness, we can't see that perspective. We're too limited in that capacity. It can give us new perspectives about longstanding patterns, but it can also dredge up the harder, more painful things too. So in other words, we think about the two as microdosing often works more like a gradual nervous system conditioning, while macrodosing is more like a temporary disruption. Okay, so it's different, and they're used in different ways. One isn't better than the other. They're equally important tools. Neither one's inherently superior. They just put different demands on your nervous system. So a couple of myths that I feel important to kind of just touch on and clear up a little bit. Bigger isn't always better, right? And that's even true in a big journey, a macro dose. People think, wow, I want to do all these grams of mushrooms. And that's not always better. It really is about getting to know a person, getting a feel for, have they had any other psychedelic work? What are the resources? All of those things. But bigger isn't always better, okay? More intense isn't always more healing either. And that's often an expectation that gets worked on in prep around, the medicine's going to take you where you need to go. And so let's build a right relationship with that. The medicine itself is not the healing. That's another big myth I think we often think about. If I just take some mushrooms or take some ketamine or MDMA or whatever that is, that's going to be the key. The medicine isn't that. It's a tiny, tiny piece. It opens up the things, but it's what we do with it. The real question is, what is my nervous system ready for? What amount? And sometimes the wisest place is not to begin with the most dramatic intervention, but with the one that your nervous system can actually integrate. Okay? So let's talk about the heart of the work. Before we do that too, I just kind of check in with people, see how you're doing. You need to wiggle around or anything. Grab a little bit of water while I'm here. Learning anything new or all stuff you already know? Okay. So I think that's a really important point to go back to for a minute. That one of the things that surprises people about the work is that the medicine session itself. We think about psychedelic-assisted therapy. The medicine session itself is actually just a very tiny percentage of the overall process. It's very small. The real therapeutic change tends to happen in the weeks and the months later, when somebody's trying to figure out how to live with what they've seen. And so and responsible models of psychedelic-assisted therapy, the work usually unfolds across distinct phases. Screening is generally the first phase, and then we move into the preparation, then we move into the journey work, whatever that looks like, and this also is applicable and true for microdosing as well, and then into integration. And each of the phases serve a different purpose. And when one of them is skipped or one of them is rushed, the process often becomes less stable and less effective. And it may not always be obvious how that happens, but it happens, all right? So let's talk about the first phase, which is the screening. It's probably one of the most important, really, because it helps determine whether this type of work is appropriate for somebody at this particular moment in their life. And so we look at things like psychological history, medical considerations, what kind of medications is a person on. We look at trauma history, what's the stability like in a person's life right now? What's their support system like? What does coping look like for this person? If coping their whole life has been, anytime a bad feeling comes up, I try to get away from it, that's information, because psychedelics do the opposite. They help us get closer, which is what's so powerful about them. We look at things like, what is the overall capacity of their nervous system to engage with emotionally intense material? Screening isn't about gatekeeping, it's about discernment. And sometimes it leads to doing it and moving forward, and sometimes it leads to slowing down, shifting directions or gears, strengthening supports, or even just choosing a therapeutic path for the moment. Both outcomes are very responsible forms of care and actually prepare for later down the road when it's time. And so after screening, generally comes the preparation phase. And this is the place where the therapeutic relationship and internal resources really begin to take shape. So it helps us clarify, why is somebody drawn to this work? And why are they drawn to this work right now? Okay. It surfaces things, hopefully, things like a person's hopes, their fears. What are their expectations for the work? Sometimes fantasies about what the experience might be like. We get a lot of that through social media and in friends' conversations and stuff. And gosh, that's what I want, Preparation also helps somebody build those skills for staying oriented when that difficult material begins to emerge, if that happens. And so it can look like things like learning how to work with your body, learning how to track sensations, how to support those. Look at working with breath. It can look like practicing orienting to the present moment. I often remind people, the psilocybin is going to be out of your body in about another 3 hours. So this isn't forever. Sometimes it's as simple as helping people come back to the present moment and moving through that. Practicing ways of meeting intense emotion without becoming overwhelmed by it. And that's really big. If you think about us as humans, we're wired to move away from pain. That's how our species has survived for all these years. If that wasn't true, we would have been extinct before the dinosaurs. So when you think about that, when you think about working to help somebody build resources to lean into difficulty or distress, it's really kind of a profound thing. And it takes practice, and it takes commitment, and it takes perseverance. Preparation is also where we touch on things like consent, pacing, medication, what medicine is most appropriate for where you are. We talk about things like dosing. We look at things like if medications, people are on medications that maybe we need some tapering. We work on coming up with programs and protocols for that as well. But it's really about helping somebody understand the process, manage those expectations, understand that it's the arc. There's going to be support in place afterwards, because the experience itself is not the finish line. And in fact, in many ways, it's just the beginning of the deeper therapeutic process. And so then comes the journey work, right? Hopefully done in a safe and supported container with trained people to be there to support. And following that is the integration phase, which is very, very important. It's not an afterthought. It's not an option. It's the therapy, okay? It's where this becomes therapeutic. Because insight alone is not healing. I mean, we all know that. If that were true, I wouldn't have a job. All the other therapists in the room wouldn't have a job. Sometimes I think I'd give that up, but we're not there yet. A person can see something really, really clearly and not have any idea what to do with that or how to live with that. They don't even, how do you integrate that? What does that mean? And so integration is really the phase where what's emerged starts to become usable. It's where somebody gets the support they need to start translating what was revealed to them, what they experienced, what emerged, and put that into daily life. How do we translate that into greater emotional regulation? How do we live through different choices? And maybe not meeting those expectations, or meeting them in a different way with loved ones who are used to us doing a certain thing or responding a certain way, and now your nervous system's going, nope, I can't do that anymore. So that's where integration becomes so very important. Helping somebody really implement and live clearer boundaries, that's a big one that comes up often. Relational shifts, because it very often does change and impact those things. And how do they how do they work with the meaning that's come up, and how do they make that sustainable and hold over time? Without integration, lots and lots of people have very powerful experiences, and it ends up becoming memories. Or, yeah, I did this thing a long while back, but I kind of went back to way things were. But with integration, that's where it becomes change. And that's part of why responsible therapy psychedelic work tends to move more slowly, because transformation that actually lasts rarely happens in a single moment. It happens in what somebody does consistently with support in that moment afterwards. So integration is a very, very important part of the equation. And that's an important thing to think about too, if it's something that you're considering moving forward with. Is, again, we talked about this a little bit, but does your facilitator, what does integration look like? What does preparation look like? Are these things in place? And so we'll talk about that here next. What do we look for, or what to look for necessarily if you're thinking about doing this work or considering this. So a few kind of what I like to think of as red flags and green flags, things to think about, can be helpful when you're looking for a provider. Some things to look for is, do they follow this arc? Is there screening? Is there clear screening? What kinds of things are they screening for? A lot of people have screening, but is there screening with a medical doctor? Are you looking at contraindications with medication, or neurological conditions, or things like that? Because, to be honest, there's not as many contraindications for psychedelic work as people might think, but there are some, and there are ways to work with that don't always mean you can't work with psychedelics. Again, we might have to shift gears and do something different. Other things to look for, what does pacing look like? Does this person, do they talk about that? Is that an important aspect? Is there consent? Is there choice? What does that look like? What kind of ethical grounding happens there? Is there integration afterwards? These are pretty important kinds of aspects to look for. Things that I hope you would pause if you see these or encounter these when you're thinking about working with someone is, if there's a pressure to go faster or more intensely, that's absolutely, in my opinion, a red flag, because it's not about more, it's not about faster, it's about therapeutic, and that means different things for different people. Someone who minimizes your fear or hesitation. I don't know any single person who hasn't been like, yeah, I'm a little nervous to do this, myself included. I mean, it's a big deal, so someone who doesn't take that seriously, someone who doesn't give you space to feel what you're feeling, that's an important thing to consider. Interpretation of the experience, that's another really big one, okay? And this is where I think a lot of people don't really understand. This isn't about helping somebody's experience get bigger or moving them through something or even interpreting the meaning, okay? That's each person's experience. That's each person's prerogative. Sometimes after a journey, kind of the landing moments of the day where they're coming back online and stuff, sometimes people have very distinct meaning. I get it now. I see this thing. But more often than not, people don't. And so, there's the conversations and stuff, but it's really about the reflective listening. It's not about making meaning or, well, when I saw that happening, this is what I was thinking. Nope, this is their experience, okay? What does aftercare look like? You know, if there's a lack of aftercare, I would be concerned about that. I would ask questions about that. What's accountability like if something goes wrong? What's a backup plan? What kind of support does the facilitator have for themselves? You know, what if something happens to them during the experience? Those things are very important because good intentions are not enough for this kind of work. Presence matters, warmth matters, training, ethics, accountability matters too. And this is especially important right now because psychedelic work is becoming way more visible, way more widely discussed, while training pathways and professional standards are still evolving. And so because of that, people sometimes find themselves navigating a landscape where there's lots of many different types of providers and guides and experiences, retreats, all those kinds of things. And it can often be tempting to choose what's easiest, what's immediately available, what's financially feasible or less expensive, or what even promises a big dramatic experience. But that kind of work often involves very vulnerable psychological material, okay? And the nervous system really deserves to be held by somebody who understands how to work with those things responsibly. So that same level of discernment that we would bring to other aspects of our own healthcare matters here as well, okay? You want somebody who knows what they're doing, somebody who has a professional structure around them that knows how to respond if something becomes complicated. You know, psychedelic work deserves that same kind of thoughtfulness because at its core, it's about your mental health. It's about your emotional well-being, your long-term well-being. And that skilled providers, they don't just guide the experiences, they help hold the entire process before, during, after, so that what comes up can actually be really meaningful and integrated rather than overwhelming and confusing. And that's part of what allows this work, when done responsibly, to become not just powerful, but genuinely therapeutic. So conversations like this are really, really important. And, you know, we need to keep talking. We need to keep having these discussions, asking the questions, and really exploring what is responsible use of psychedelics look like. And if nothing else, we have to keep coming back to safety, safety, safety. You know, and what does that mean for each person and individual?
If you'd like to stay connected or explore upcoming events, you can learn more at psychedelic-stl.org.